which is good. I know you just mentioned what it is, but I don't know if anyone kind of wants to guess what it is based off of the answer choices, and we could kind of talk a little bit more about it. Does anyone want to venture a guess on what they think the answer might be?
I can mention, I guess, just because this slide also I feel gives me some context clues. Because without this, I would have had no idea. But it seems that it may relate to barriers that may be differentially felt by certain groups. Thinking about the proverbial glass ceiling versus steel ceiling, which is another concept, but things like that.
Yep, definitely. So yeah, yeah, you put it right on the head. And then the answer for this question is B. Women are more likely to break the glass ceiling during periods of crisis or downturn with failure is highest. So yeah, that's essentially what the glass cliff is. It's just being put in a position where you're essentially kind of being set up to fail. So on paper, it looks like you have an opportunity when really you're not given the tools you need to succeed in that opportunity. Um, and so, yeah, I guess that just kind of goes into like, in terms of like the changing DI landscape, there's so many, not only terms, but just concepts that unless you kind of dig a little bit deeper into it, it's really easy to not be familiar with what they are. And then when we talk about DEI, I know a lot of the emphasis is on race, and even a lot of the executive orders that have been talked about DEI have all put an emphasis on race and ethnicity. But really, when we talk about DEI, we're talking about diversity and includes any and all groups. So this includes veterans, people from different religions, people from different sexual orientations, people from different backgrounds, like if living in rural areas versus metropolitan areas, various forms of abilities or disabilities, different socioeconomic status, income, career aspirations, organizational involvement. So really, when we talk about DEI, it's not just race and ethnicity, though that is one of the things that is always, I believe, emphasized in the media, but it's really all encompassing to talk about like all groups from all different backgrounds. And in trying to understand DEI, one of the main things to understand is it really ensures meritocracy and it's ensuring that there are qualified and talented people. So I know even part of what the letter was that went out to universities, but trying to stop racial preferences and saying, kind of mentioning that race might be a factor, but it's not a factor. When you talk about DEI, it's not a factor that kind of pulls in people who aren't qualified, but just making sure that there is a diverse applicant pool in order to bring in what the type of high quality professionals that you want in whatever sphere that you're working in. And the real goal with DEI is to make sure that there is high productivity, high innovation, and high operations, regardless of one's background. And it's just making sure that you have a wide applicant pool to do it. So it really does encourage meritocracy and not discourage it. Um, and there was like a article that was published in USA Today that just talked about like what the executive orders do not prevent, and they do not prevent one promoting a diverse workforce of qualified employees. It doesn't prevent ensuring fair treatment and access for everyone who's working and removing barriers, and it's not preventing one creating an environment where people from all backgrounds feel welcome. So, in spite of the executive orders, when you really kind of get to the nitty-gritty of what it is, it's not stopping you from creating a cohesive environment. It just really has to make you be mindful on how that kind of looks. And so, why are we talking about DEI at academic medicine and in a conference like this? So actually, this organization, BingGap, previously wrote an article where they had 46 experts that were determining what the functional competency domains are that are needed to have a successful academic medicine career. And DEI was one of them, just kind of showing that we're talking about it because it is important, especially if you want to have an academic medicine career, to know what DEI is and kind of make sure you're really grounded in it in order to have a successful career. And so, what some of the issues that we have with DEI officer positions? Um, and so, even though, there is a need for DEI, and we'll talk about why in some of the upcoming slides, there is a high attrition rate for it. So, especially after the murder of George Floyd in 2020, there was a 55% increase in DEI roles. But by the end of 2022, the attrition rate was 33% compared to 21% for non-DEI roles. And that is even decreasing even more, especially with some of the executive order, because a lot of universities, like recently, University of Michigan shut down their DEI office. So the number of DI officer roles are continuing to decrease. Um, and I know especially like after 2020, they were calling it the great exodus of corporate DEI positions, where a lot of organizations had a position and then they were vacant for years and they weren't able to fill it. And so there was a social impact strategy firm called McPherson Strategies, which looked into see why DEI programs were failing. And they found that there were four key reasons why. One, there weren't enough resources. Two, it was assuming that it was a one and done process, assuming that you could just do one initiative, one project, and that would kind of solve all your DEI issues. Three, the constant pressure to meet numbers, especially since the objectives and the ROIs for a DEI position won't be the same as for other departments. And then four, lack of executive support and funding, which again is kind of a little bit what we're seeing with this current landscape, political landscape. If the head institution, the person at the top doesn't support DEI positions, it is really hard to kind of have the momentum and continuing to live out those objectives and those goals that you have for the organization and for that the office position. And so there was a organization called WMFDP, White Men as Full Diversity Partners, which wrote the 5 C's that are needed to have success in a DEI officer role. And this was written mostly for corporate America, but a lot of it applies to academic medicine as well. And the 5 C's that are needed are clarity, consensus, consistency, collaboration, and cash. And I'll talk about them more in the following slide. So when we talk about clarity, we're talking about making sure you're able to really identify and articulate what the problem is. If you don't know what the problem is, it's really hard to kind of have an objective of even being able to meet it. Um, and in doing that, you should make sure that there are clear and realistic and measurable goals. So that way you're not being put in a position where you don't even know what the target is that you're trying to reach, because how can you reach a target that you don't know what it is, or it's hard for you to articulate it. So being able to identify what is the problem and have a measurable goal for meeting it. So that way when you meet it, you could kind of look back and say, this is the goal that I wanted to meet, and then this is how I met it. When we talk about consensus, this really is about having leadership buy-in from key stakeholders. If you don't have the buy-in from your leadership, it's going to be really hard to have success in any DEI position or any position really in general. And a lot of this is being able to find common goals between your program and the center that you're a part of. And this is all about building allyship. So if you're able to show the leadership in your organization, these are what our goals are as the DEI office or within this DEI position. And this is how it aligns with the institution's goal and how it supports the institution's goal and how they really work together. That's how you get your leadership to buy in. And once they buy in, they will be more willing and likely to support those initiatives going forward. So it's really about figuring out how your objectives align, and making sure that you have buy-in from people who are in a position of power to kind of keep those initiatives and those ideas going forward. When we talk about consistency, this is one about making sure that there's continuous education and training for everyone involved. Kind of like what we're talking about during today's presentation, but figuring out how can you stay up to date in different DEI topics and trends, and how the landscape is changing and how you should be adjusting in light of that, as well as finding a way to make DEI efforts scholarly work. A lot of times, especially for academic institutions, a lot of the promotable activities, unless a lot of times you focus on doing things that are promotable, that kind of helps with like, becoming, assistant professor, kind of moving up your academic ladder. And a lot of times if DEI works aren't scholarly, it might be easier to fall on the wayside. But finding ways to make these efforts more scholarly will help to make sure there is consistency in those who are doing those that work involved in those organizations, because they know it's not only helping, the organization as a whole or helping the greater good, but it also will help them personally in their careers. So that kind of helps to maintain or build consistency within the role. Collaboration, it's been seen that, diverse workforces outperform homogeneous ones. So being able to collaborate with other departments, with other institutions, that kind of widens your network, it widens your web, and also just gives you additional ideas on how you can be an effective DEI officer because you now have expanded your network as well. And then cash, making sure that your role, your department has the budget, has the funds that are needed to be effective in your role. And with doing that, even having the authority to make decisions, even if you're not a DI officer, but having the funds and the cash to be able to do it. I had attended a conference once, and one of the speakers was a program director, and they said that their most effective DEI role was as a program director because they had the cash and the funds that they needed in order to put forth DEI initiatives without necessarily being a DEI officer. So it doesn't necessarily need to be a specific role, but whatever role you do have, having the cash and the resources and the authority to make decisions to make those initiatives go forth. So as a DEI leader, a lot of it's kind of making sure that you're creating a culture, one where there is celebration, allyship, and scholarship. And these are kind of the three things that you really want to have within your organization, within your department, that will help to ensure that the members of the organization have a sense of belonging and they're able to have a fulfilling career. Um, and so we'll talk about so allyship, sorry, celebration, allyship, and sponsorship, which we'll talk a little bit more in this slide. So there was an article that was published in 2023 that assessed how to enhance DEI efforts in the workforce. And they saw that what it really boils down to is having a sense of belonging in the environment that you're in. And so there was research done by a group called COCAL, which is a nonprofit think tank, and they found that a sense of belonging is rooted in having four main elements. One, being seen for your unique contributions. Two, connecting to your coworkers. Three, being feeling supported in your daily work and career developments. And four, being proud of your organization's values and purpose. And the researchers found that individuals with a higher self-perceived belonging in their workplace reported more likely to retain and stay at the institution. They had greater job engagement. They were stronger organizational loyalty that they have for the organization. Had better employer brand endorsement, and they had less career stall. And if we extrapolate this to the educational sphere and we think about, medical education and students who have a sense of belonging and we're able to make them feel seen, connected, supported, and proud will also be better learners and ultimately better physicians, which is our goal as medical in medical education. So now we're going to shift gears a little bit and talk about how you can stay up to date on DEI topics as an officer or as a leader in your institution, so that way you can remain effective in this field. And this really requires you to be a lifelong learner, which is something that requires a lot of intentionality. Why do we say lifelong learning? Medicine is lifelong learning, and how can we stay up to date? Does anyone kind of want to take a stab at why we think medicine is lifelong learning and kind of what this might look like? Yes, Dr. Spencer?
I mean, as a medicine, as a clinician, um, the field changes, best practices change, and what you learned in med school maybe a couple decades ago, the practice may be different now. So it's important to keep on top of newer information, newer changes, and this would, I think, extend in a DEI role as well, since definitions best practices for how do we enhance sense of belonging and things also changes as we learn more.
Yeah, definitely. That's definitely true that things are always constantly changing. So unless you're on top of it, you will definitely fall behind. Anyone else want to share? Okay, let's move to the next one. And so yeah, we brought up good points about, it's constantly changing. So it is something that is important to kind of make sure you're staying intentional about. And so in terms of how academic physicians do it, there are a couple of different ways that they conceptualize how to be a lifelong learner. And so there was a qualitative study that was done at UCSF that sampled 34 academic physicians to see how they conceptualize the purpose of lifelong learning and how they engaged in it. And there were three key ways that they kind of viewed lifelong learning and the reasons why they did it. One, as a way to maintain competence, one as a source of personal growth or fulfillment, and then one as a professional stewardship. And so when we talk about maintaining competence, this is really about kind of staying up to date with literature, with methods, with guidelines. They kind of view this more about medical knowledge and clinical procedures, but they also did like mention that they did kind of try to do this as well for DI, communication, teamwork, leadership, and quality improvement as well, but it was mostly towards kind of medical knowledge and clinical procedural skills. When they talked about conceptualizing lifelong learning as a source of personal growth and development, these were things that aligned more with their identity and helped them to maintain what things that they were more curious about and the novelty of their work. So this sometimes was formal, sometimes was more informal, which could just be, more self-study and conversing with their colleagues. But like the key distinction between maintaining competence and lifelong learning as personal growth was really about the opportunity to delve deeper into a topic for reasons that might be more about their own curiosity and interest versus like having an immediate need to serve their patients in that moment. And then when they talked about lifelong learning as professional stewardship, this was more about them committing to sharing their learning with trainees and colleagues for the greater good of the profession and to improve patient care. So, when they talked more about how they engaged in lifelong learning, kind of like not just the why, but how they were able to do it, they kind of broke it into three ways that they were able to engage lifelong learning. One was contextual, just being in an academic environment in general. They felt like really helped them to be lifelong learners because they had access to a lot of training, to research, to professional development, and just being able to work with their colleagues gave them a sense of accountability that help them to be a lifelong learner. They also mentioned the second bucket was social learning processes, just being able to talk with their colleagues, observe others, and being able to get feedback. So a little bit less formal, a little bit more of that like informal way of engaging in lifelong learning. And then independent, so kind of doing intentional activities like going to conferences and journals, and just reflecting on things that might be happening. And um, and so one of the key things that the study found was that, really intentionality is needed. And so even though there was a big focus on lifelong learning to maintain competence, there were other aspects of lifelong learning that they found important, but it was hard for them to describe. So even though they were the study participants were really able to support clinical medicine and felt confident in their approach of being able to describe lifelong learning medicine for clinical aspects, they had difficulty in describing and felt less confident about their practices and domains with interpersonal, relational, and emotional components, just kind of showing that like if you're not really intentional about um, doing it, it's going to be hard for you not to only articulate it, but then kind of live it out as well. And then one of the quotes I really liked in the paper was on the right of the screen. If their supervisors were not openly discussing and modeling their efforts to improve relationships, emotions, and well-being, trainees are less likely to do so themselves, and a professional culture resistant to discussing vulnerability persists, kind of just like reinforcing that if you're not really intentional about creating a culture of lifelong learning and kind of not only focusing on the clinical aspect, but some of those other aspects as like DEI, interpersonal, relational and emotional components of lifelong learning, it's going to be hard for your trainees to do it because they are following what you're doing. And if you show them that it's possible, then they know that it will be possible and they are more likely to try engage in that in the future. All right. So I guess just in terms of DI topics, we talked a lot about like, how it could be done and the different buckets for it. But what are some challenges that you might be facing as you try to keep up to date with DI topics? What do you like to share, like if difficulties that they might have? Or maybe even if not a difficulty, something that you found has been helpful for you to kind of making sure you're staying up to date.
I think something that's being help has been helpful is just having, conversations, opportunities like this, having some executive board meetings when we kind of touch base with other institutions and see how they're navigating some of the political changes or department changes. So, kind of things that you touched upon, but just, yeah, opening the floor, having those conversations, how everybody's feeling, how everybody is trying to still be passionate and have these initiatives and encourage students to continue them, but just how to kind of change some wording or tailor things to fit what is currently happening.
Yeah, definitely being able to like, change the wording, so that way you're able to stay kind of remain engaged without like facing any particular backlash. Um, Patricio?
W- I'm in a in a basic science department, and one of the things that sometimes is, uh, I guess, common in basic science department is that these topics are avoided or at least not actively discussed by colleagues because I guess the focus is on the science or the scholarship, call it whatever you want. And so there's often a lack of intention to actually engage with these conversations, and uh, that sort of it it happens to be in rather stark contrast with the information overload because these days DI is everywhere, uh, and it's sometimes there's a challenge in saying, okay, we want to do something about it, but where do we start, and what are the resources that we need to start to advocate uh, for for these conversations, basically, uh, with our trainees, with our colleagues, with the institution in general.
Yeah, definitely. Yeah, I definitely can understand, the idea of information overload, not knowing where to start, and like the best place to kind of like, put your efforts in, especially if you have limited time, knowing, where you're going, how you're gonna kind of prioritize what to do first and next. So, would anyone else like to share? Before we move on?
Yeah, I think one of the other challenges with DEI is it can be such a broad field. And I think that a lot of times many of us become experts in subtopics of DEI, which in itself is already challenging. It can take a lot of time to become very knowledgeable and stay up to date on a particular DEI topic, of your focus. But knowing that almost all DEI issues are intersectional and impact different groups in different ways, I think being able to stay up to date on how all of the different communities that benefit from DEI are impacted, and being able to stay up to date on all of the new emerging evidence for those things, that information overload and the time constraints can be really challenging. And so it's kind of hard to be a general DEI expert, and easier to be more of a focused expert, but it's not always the best way to go about DEI efforts.
Yeah, that's definitely like a really great point. It's such a big umbrella and there's so many things, especially when we talked about like one of the earlier slides, like, what is EI diversity is a huge gamut of it. So it is easier to kind of, and I think it's more natural sometimes to kind of fit into one particular subsection of it. But then, yeah, kind of like maintaining that balance of like knowing your subsection, but also knowing the overarching, like being familiar enough, broadly enough, to kind of just like be familiar with some of the basics could be really hard. Just because there's so much and it's constantly changing. There's always so much that's coming out that you kind of need to make sure you stay on top of to, really be able to contribute to the conversation. So yeah, awesome. Would anyone else like to share before we move on?
I have one other thought. Sometimes with DEI as well, like you can have all of your best efforts to get it right and do a good job and still not succeed. And I think that that's also something where there tends to be a higher bar that people might hold. And so like, you could be trying your best to be super inclusive and then somehow end up getting, I have a very specific random example in my mind of one of our leaders at my institution who was doing a DEI activity and ended up being called anti-Semitic by students, when the leader herself was a Jewish woman. So there's like issues where if you don't get it right, it can really cause a lot of harms, even when you're trying your best. And so it's also more difficult in that way.
Yeah, definitely. A lot of people like they put their own like lens and perception of what DEI should look like and what it should include. And if you're not kind of fitting that mold, it could be really hard to please everyone. Which I think a lot of times, in DEI, people think that you are trying to please everyone, when really, it's just hard to do, especially because there's so much that could be covered in DEI, and the risk for offense is so high. So. Awesome. Anyone else before we move on to the next slide? Okay, great. So now we're just going to talk a little bit just about like different resources that are available to stay up to date on DEI topics, which I know we mentioned there's so many different topics or subspecialties or subgroups within DEI, but just some resources that are kind of helpful. There are a lot of different academic journals. So there are journals that are kind of just more focused on DEI topics. So like the Journal of National Medical Association, the Journal of Health Disparities Research and Practice, and the Journal of Minority Health. There are conferences, both like general conferences that might have DEI specific topics, as well as ones that are more geared towards DEI topics. Like the AMC has a GDI meeting, NMA has annual meeting, Big Gap has national and regional meetings that discuss different DEI topics. And there are student groups that have conferences like SNMA, LMSA, that, are ways to kind of see what's happening in the different landscape. And then there are books as well. Big Gap has a lot of resources on our website. And then there are also just like different books that are more targeted towards DEI topics, as well as podcasts. And there are also even DEI certification programs. Um, and why do we want to make sure we're staying up to date? I think like it was mentioned earlier, I think that Dr. Spencer had mentioned earlier, but that the landscape is constantly changing, and not only are things in DEI changing, but things in medicine that might impact DEI are also changing. When you think about just like clinical medicine, it might also change things DEI. So just making sure you're up to date to know, what is happening, so how to best target it, both as a leader and then and like in your DEI officer position, and just as a clinician in general. So just in terms of medical journals, like I mentioned, in addition to journals that might have articles that are DEI specific, there are also journals that are more geared towards looking at health disparities and looking at minority health and kind of how to overcome that. There are books like Belonging and DI Deconstruction, or just two examples for it. There are conferences and seminars that both like nationally, internationally, both DEI more specific conferences and more general ones. And especially like if you're going to a meeting that maybe is not a DEI specific meeting, but just a general meeting, let's say an AAMC meeting, there's some intentionality that you could do in order to kind of make sure that you're staying up to date with DEI at those sessions. And part of that is really just making sure you're intentional, which I think is kind of like one of the themes that we've been talking about today. Just kind of making sure you're reviewing the program and seeing what sessions are pertinent to your interests and goals, especially about DEI. And then see, are there specific sessions or maybe there's just a thought leader at the conference who might not be leading a DEI session, but they are a thought leader in DEI, and seeing, is there a way to meet with them? Is there a way to collaborate? You don't necessarily always have to go to a specific session to kind of get that information. You could just connect with people who have those same beliefs and ideals as you at the conference and see what are they doing at their institutions, how are they working out their practice, and kind of just get that same kind of informal information that way as well. And then this kind of goes into like, incorporating DEI in your CME plan. When we talked about the 5 Cs previously about being an effective leader and consistency being one of them, and consistency being, kind of making sure you're able to get CME credits for DEI work that you already enjoy and feel passionate about doing. If you're able to get CME credits for it and it helps you to maintain your professional certifications, it kind of helps you to be consistent in it because now it's not something that you're just doing because you're interested in it, but something you're able to do because you're interested and you're able to kind of get the credits that you need to maintain your certifications. So just kind of like thinking about, DI topics in that way and staying up to date in that way to see how can it really help you not only with your own personal interests, but with your professional endeavors as well. There are a slew of online resources and databases. UpToDate is one that, talks about medical information and guidelines, and sometimes they are about, minority health and different guidelines relating to that. There are online databases like PubMed, which often, again, talks about clinical guidelines and review articles, and a lot of them can be about DEI topics. There are podcasts, both general podcasts like JAMA that might have DEI specific episodes, as well as DEI specific podcasts as well, like Uplifting Impact podcast. There are online DEI resources. So I did check these websites last night and they are still there. I know with the changing landscape of things, you never know what might be there or gone. But Rutgers University and University of Michigan both have websites that have a lot of resources on DEI, including TEDx videos, articles, books. So they have, especially like if you're not really sure kind of where to get started or where to kind of get resources, these two websites have a lot of information on their websites, a lot of great papers, articles, ebooks, videos, seminars. So it's a great kind of starting place just to kind of see, if you don't know where to get started, these are great places to start off. If it's something that you kind of want to, delve deeper into, they have DI certification programs. I checked all of these last night and they are still all there too. They have not been taken down. But AMC, Cornell, Harvard, and NYU all have certificate programs that are centered towards DEI topics. They range, some of them are kind of like on your own at your own pace. And some of them are a bit more structured. Like I believe the Harvard one is like a 6-month e-course. So if it is something that you kind of want to make sure you're really kind of competent and prepared in how to be an effective leader in DEI and really be aware about DEI, kind of approaching it from an academic standpoint, they do have certificate programs that you can enroll in and kind of get the training and support that you need through that. And then just additional resources, especially if in terms of like being a DEI leader and kind of like the mentality that you need to be about it, kind of going back to the idea of intentionality and planning to succeed. There are toolkits that are available that kind of will help to make sure that your projects and initiatives are able to meet those DEI objectives that you might have at your institution. And so Master for Center for Performance Improvement published a toolkit which kind of looked at the different toolkits that are available and tried to see like how they could improve equity and performance, especially when it comes to health equity. So they developed a novel QI toolkit that engraved issues of diversity, equity, and inclusion, and social determinants of health into their Institute of for Healthcare's improvement tools. And so what they did was they have fellows that always have to do QI projects, and they performed a 5-year retrospective analysis of previous fellowship projects to see how bias, inequity, and social determinants of health were incorporated into those QI projects using this their toolkit, the Institute for Healthcare Improvements Model for Improvement, and their associated tools, which is like what their program uses. And so this was done across all of the QI fellows, which was for physicians, nurses, operational, and for pharmacy leaders. And they analyzed the previous when they did the retrospective analysis, they looked at the see for the previous 5 years, how much were DEI and social determinants of health kind of addressed in the QI projects. And so what they found was prior to using the toolkit, when they kind of used the toolkit in a retrospective analysis from 2016 to 2021, they found that about 22 or 23% of the projects were able to incorporate DEI or social determinants of health into any stage of the QI process. But once they used their health equity toolkit that they kind of put together and developed, they found that there was an increase to 89% in 2022. Kind of just showing that when you're intentional about even using a toolkit to see, with the QI projects that we're already doing, how can we make sure that it's also targeting DEI and social determinants of health? When you're intentional about it, there are great strides that you could kind of make in this landscape, in these topics. And some of the questionnaires that were used in that health equity toolkit that they developed includes Project Carter, stratified baseline tool, Shawana fishbone diagrams, and Plan, Do, Study, Act worksheets. So kind of just making sure they use these worksheets when developing their QI projects, help them to be more intentional about addressing DEI and social determinants of health within their QI projects. So I know we talked about a lot, and there's, a lot of different strategies for, kind of staying up to date, how you stay up to date, the resources that are available, kind of like how do we do all of it? It really is just kind of making sure you explore different strategies. You kind of ask around your colleagues, your attendings, your, people that are in your sphere. I know we talked about information overload before, so really just like trusting what you see, but verifying, making sure that the source that you are seeing is credible, because you want to, the worst thing is kind of making sure that you're getting an information that's not really from a credible source. Setting realistic goals, and then taking advantage of any work-related educational activities that might be before you. So now we're going to dig a little bit deeper into some case studies. So for the first one, case one, you are the current DEI officer at a new large medical practice. You are told that the office has received multiple complaints that the parking lot, information pamphlets, and welcome posters being placed are not ADA compliant. How do you go about navigating these rules and policies? So would anyone like to take a stab at how we would go about this case or handling this case if it came across your desk? Dr. Spencer?
I'll take a stab. I would love to see other people have their thoughts as well. First, if there's been multiple complaints, it's helpful to bring all the complaints together to see what themes, so that we are being responsive to the feedback. But then it's about making sure that you or the appropriate individual who may be in charge of ADA compliance are familiar with what the rules and policies are. These are federal statutes, so there's not big question. And then you can see where there's misalignment, or if you are following the rule, but it's still not addressing the concerns, then you can see where the delta is and try to address it.
Yeah, awesome. Yeah, like putting the complaints all together and trying to see, do we, even if you are compliant, there's still complaints. So there must be something that needs to be addressed. So making sure you address that. Awesome. Jonathan Hulse?
Yeah, so I think one of the things about this is not something that you can do alone, especially with these big sort of structural systems based barriers. Like you as the DEI officer are not going to fix a parking lot. And you as a DEI officer are not going to be responsible for reviewing every single pamphlet or poster that's within an entire institution. So I think that you have to start identifying like what are the systems level changes that need to be made, and then at what level can you begin to influence those system level changes. So whether it's raising the issue to someone above you, like to, I don't know, the vice president of your organization or something like that, to start thinking about how can we get funding or grants to be able to update our parking lot so that it's ADA compliant, or thinking about how do I offer training sessions for individual departments to be able to review their own materials, know what to look for, to be able to make changes to their pamphlets or things like that. And then how do you also begin to implement systems to evaluate whether or not those changes are actually being done and whether or not they're being done effectively. So there's like this really broad institutional network that you have to be able to interface with, um, that that will be difficult and that you alone cannot necessarily achieve. So there's team-based efforts for sure.
Yeah, definitely. I really like how you talked about like just like the system-based approaches because yeah, it's not something that one person alone can do, but making sure that the institution as a whole have the people in place, education in place, the resources in place that they could tackle what needs to be done on their end and on their end and knowing, what they kind of need to look out for. Because yeah, it's impossible to review every single pamphlet as a DI officer for the whole institution. But if everyone in all the departments know kind of what they need to be mindful of in creating pamphlets, will kind of help make sure that it's sustainable, and it also will be able to be carried forward. Patricio?
Um, in I suppose what I wanted to add to what Jonathan and Dennis just shared uh, is that depending on the size of the institution, like might be a large medical practice, might be a university system, hospital, whatever it is. Um, but I think it's important to, and when as Dennis suggested, when you're putting all of these complaints in like together to identify patterns, um, to also engage uh, the way that Jonathan just mentioned, engage other stakeholders in identifying whether these are part of a pattern of activity, if these are things that have um, been problematic before, and to determine if this is a matter of institutional culture or if these are isolated incidents, which I think is an important thing to sort of keep in mind. But that's all I wanted to add.
Yeah, that's definitely a really great point. Is this isolated or is this, an institutional culture? Because the complaints came, regarding ADA, but it could be very well come for a different group in the future if it is a culture issue at the institution and not just about, one thing that wasn't addressed or looked at. So yeah, definitely a great point. Anyone else would like to share?
I have a comment related to this idea of institutional culture. I don't know if this is the case at a lot of other institutions, but at my institution in particular, with ADA compliance, I feel like I've seen a general mindset of we will do the bare minimum that we need to not get sued. So it's like what are the policies that we have to follow? What are those rules? And then are we doing enough to make sure that no one can sue our institution, rather than having a culture. Oh, is that my fault? Am I really quiet? Anyways, shoot. Anyways, not necessarily having a culture where people are trying to go above and beyond to make sure that the environment is like inclusive for everybody. So I think sometimes being able to get people on board with ensuring that they're doing what they need to not be sued can be like the first starting point to get changes to happen. But having a cultural shift that goes above and beyond that can be more challenging.
Yeah, definitely. Like having that, like, a mentality of bare minimum is, really hard to kind of sometimes break. But kind of going back to some of those earlier slides, if I think hopefully the goal should be like, a culture of belonging, right? Because if it's your workers who feel like they belong more now because everything is not only compliant, but really, servicing and targeting them in a positive way, or even if it's your patients, if they feel like they belong at your institution, they're going to be more likely to give referrals. They're going to be more likely to give good reviews, right? So I think, when the culture is like the bare minimum, it makes things really hard versus if the culture is one of belonging and everyone feels like I am seen and valued and heard in this institution. And now I'm able to kind of pour back in a way that I wouldn't have before. But it is hard to make that culture shift.
Just to make a point to that, because again, this person here is the DEI officer, and in my own roles that sometimes include DEI hats, if you are senior enough and have a large enough bully bullpen, you go back to those what was it, the 5 C's you said? You bring in collaboration with individuals who are impacted by these decisions that we're making. So I try to make sure my committees, for instance, that I have at least at least a single, but for sure as many as possible, individuals with disability, because that is a major part of your purview. And just like it's harder for you to poo-poo a concern I have about a racial, ethnic issue, because I'm the black man in the room. It's hard as well for someone who has a disability to for the committee to really poo-poo a concern around ADA when that person's sitting right beside you who is impacted by it. And if you have no shame and you still poo-poo it, then hopefully that person who is impacted by ADA, who's at the table as well, feels empowered to, speak up. So that collaboration piece is super important because when you have a homogeneous group always making decisions, that's how people do get marginalized and, not given the due attention that they should.
Yeah, definitely great points. Yeah, if someone's at the table, then it's a lot harder to say this is not important or, we didn't know because a person's at the table. So, yeah, that collaboration piece is so key because when you have people at the table and they're able to speak about their experiences and why it matters and how it impacts them, it's a lot harder to turn a blind eye to things like that. Awesome. Anyone else want to share? So yeah, so I think we talked about a lot of it previously, but just kind of like taking like, initially like maybe a research approach to it, but what are the violations, gathering them, who's being mentioned, what is the policy, how can we stay, what is the policy, how can we, follow it, what has been talked about, looking at different databases like PubMed, Google Scholar, Web of Science, and seeing, have people talked about this? How have their institution, maybe there's like, a report or a case study or something about how institutions were able to kind of, follow ADA policies or, what their best practices might be. Seeing if they have, whatever disability organizations or websites that might be possible that are available that have information and resources kind of getting more, like Dr. Spencer just mentioned, if we don't have anyone in the institution who might be able to give their buy-in, are there organizations and resources out there that we could kind of use that information to kind of get their perspective and include the buy-in in that regard? um, Reaching out to departments that specialize in the topic. And then I think one like thing that we didn't really mention, which is kind of like informing and apologizing the affected parties. It's a very public thing, especially if there are multiple complaints. So it should, potentially be addressed in a more public manner as well. So that way, those who are making the complaints know that these complaints are being reviewed and we are addressing them. It won't be ignored, even if it might not be an overnight solution. But just so that way, those who are making the complaints know that they are being heard as well. Right. For the next case. Dr. Garcia, president of the Resident Association at the University of Arizona, has been invited to give a talk on diversity, equity, inclusion at a national medical conference. The focus of the talk is to highlight how DEI principles can improve patient care in Native American populations. Dr. Garcia has experience working with the Native American population, but wants to ensure the presentation includes the most current research, best practices, and case studies on the topic. He also has a Native American co-resident who does research in DEI. Dr. Garcia has 3 months to prepare for the conference. How do you recommend that Dr. Garcia prepare? So, any ideas on how you could prepare, or just overall thoughts on the case in general? Mm. Or is it? Oh, okay. Yes, Jonathan.
Um, so the way that I like to go about a process like this, and it seems like Dr. Garcia is already primed to do this. I think there's a few different approaches. One is sort of the anecdotal approach where um, Dr. Garcia can think about um, all of the interactions that they have had with Native American populations and what's been important for success in managing the health of that population, but also communicate with people who are specialists or who are experts in this field to understand their perspective, as well as the perspectives of patients from that population and what their needs are. So talking to the communities and the experts, and then also doing a literature search. So identifying what are the up to date best practice recommendations available. What is the knowledge available at the time, and then putting it all together.
Awesome. Yeah, kind of like yeah, going like the different approaches and trying to like get information as different places as much as you can and put it all together. Um, which, thankfully Dr. Garcia has 3 months, so he does have time to kind of prepare the presentation in that way. Um, awesome. Anyone else have anything they want to share for this case? On like how to prepare the case in general?
I mean, I think that it's also not it's not cheating, rather, to just as people, for purpose of like this writing fellowship, we tell you to look into Meta Portal to see if there's anything that's written on this already. You can see if there are PowerPoints of presentations that are published on this topic. It's potentially so niche that you'll find that you don't have anything that immediately comes up on a search. But if you do, that's not cheating to like see what their approach was. See if you agree with said approach. I'm not saying you take their slides, but like it's useful to not necessarily start from scratch, reinvent the wheel when not necessary. But beyond that, though, certainly, talking to your co-resident, certainly doing your due diligence, looking at the primary data, literature. But there's more just a pro tip. It's not fair. It's not cheating to look up presentations.
It's definitely like a great idea. Just say looking at my portal and see, does someone already talk about this? What can we, use in creating the presentation, especially because there might be like really good information out there that you don't want to be lost just because you wanted to do it all by yourself. So, awesome. Anyone else want to share? So just because especially Dr. Garcia has 3 months to do the presentation, there's a lot about time management that could kind of be talked about with this presentation. And just take a little segue and talk about, especially for, Dr. Garcia as a resident and things that we could, consider as medical students, as attendings, making sure that you have proper time management, good time management techniques and practices is really important, especially when you have a presentation, but for anything you might be doing. So just different methods that people use for time management. You could do time blocking where you kind of identify your tasks, create a schedule, and create and schedule work blocks to do tasks, and then balance your schedule based off that and making sure you stick to it. So for this example, Dr. Garcia saying every day I'm going to work on this presentation from 9 to 11, just making sure that, Dr. Garcia kind of puts specific blocks of time in his schedule to do the presentation. So that way it's like done, slowly and not cramming to do it a couple of days before the presentation is due. In terms of task batching, this is a time management technique where you kind of group similar tasks in a dedicated block of time or at a dedicated time. So that way you're not kind of like switching back and forth. So maybe Dr. Garcia, if he's going to be talking to his co-residents and getting information from some of his patients, maybe saying, on Monday at 3, I'm going to spend, however long it takes kind of like setting up all of my meetings and correspondence with you know, members of the Native American community. So that way I'm prepared and getting like that background information for my presentation. There's day theming, where you're kind of assigning different themes to each day and kind of doing, all things that day. So for Dr. Garcia, it could be, every Monday I'm going to work on this DEI project, or maybe or on this presentation, or maybe every Monday, especially because Dr. Garcia does a lot of DEI work. Every Monday is going to be my DEI day, and I'm going to set aside that day to do all things DEI, and that way it's not flowing to different days of his week. And then there's also time boxing, where you're setting a fixed amount of time to work on a task and completing as much as possible during that time frame. So Dr. Garcia could say, I'm going to do 20 slides, tomorrow from 9 to 11, trying to get as many, like just those 20 slides in. And if I finish earlier, it's great. If I finish later, fine. But the goal is to do 20 slides. So these are just different techniques for time management that Dr. Garcia could use. And when we talk about, time management, it's really important, especially when you think about having a career in academic medicine, setting aside non-clinical time to do academic and scholarly work. And this could be, anything that's non-clinical, so research, leadership, community service, or whatever your passion project is. If you are in attending, this is something that, it'll be important to make sure you negotiate your contract, because if you don't have this time set aside in your contract, it's going to be really hard to do it. And as a resident or as a medical student, this is a good mental practice to have about setting aside time to do things, because if you don't get into the habit of setting aside a day for your community service project, a day for your research or for your leadership roles, it's going to be really hard to balance it down the line. So in your training, it's important to kind of just practice the skill of having protected time. And once you're able to have a contract, making sure that you set that aside, because if you don't set it aside, it'll be really hard to sustainably continue it, because time is your most valuable resource. So kind of going back to the case and Dr. Garcia. So one of the things Dr. Garcia could really look at and see, should he even be giving this presentation? He has a co-resident who is Native American, and the topic is on Native American health. So he could even see, offer to his co-resident, maybe his co-resident is better equipped and prepared to lead the presentation instead of Dr. Garcia. Or maybe they could give the presentation together and be co-presenters. So kind of really see, is Dr. Garcia the most qualified person to give the presentation? Just because he was offered it doesn't mean he is the best person to do it, especially if there's someone in that population who he, works closely with and might be better prepared or better qualified to give the presentation. And then time management techniques, like we mentioned, time blocking could be one of the things that he does. Literature review, kind of we mentioned, going through PubMed, going through MedEd Portal, seeing what we already listed about health disparities in Native American health. Again, collaborating with the co-resident faculty, kind of using the contacts that he has, if he decides that, or let's say, the other co-resident decides that they are not able to lead the presentation, but still would like to help in any regard and provide information. And then looking at whatever professional organizations or conferences that might be around that talk about these topics, and kind of attending them beforehand just to get a sense of, what's the landscape, what have been the recent changes, so that way that his presentation is as up to date as possible. and then checking social media, whatever reliable resources might be there. Um, so yeah, any thoughts about that? Because I know that there was like a couple different things that came up with that case. If anyone has any thoughts they want to share.
I find it interesting the last point there with checking the social media, um, and then reliable sources. Using social media to identify sources that then can be vetted. So, like if LinkedIn has some .gov or trusted.org links, or are we using people's hot takes on social media, which I think we should not be.
Oh yeah, definitely not that. But yeah, seeing whatever like they might share that might be linked to like a .gov, .org, kind of like using it that kind of like we mentioned the trust but verify, or like checking the sources. So seeing what might be there, but then also going and doing your due diligence to see what might be happening. But sometimes like seeing social media could just even be informal. Maybe there's a lot of complaints that people are posting on social media. Twitter, everyone's tweeting about their grievances with a certain institution or a certain organization. And then you could do your deep dive and see like, oh, this is something I wouldn't have known had I not followed this or look at this hashtag just to see what people are talking about. All right. Anyone else before we move on? Okay. And I think for the um interest of time, we'll just do uh yeah, sorry. I think for the interest of the time, I'll just skip to this last case. So you're a DI officer at a major institution, a transgender medical student contacts you and indicates everyone is referring to me by the wrong pronoun. She states one of the issues is that my school is not correct because they're using my dead name for my school email address, and the school has said that until my name is legally changed, they will not be able to change my email address. So what are some resources you would utilize to help the students concerned? What are some of like the issues you think the student might encounter? And like, what are some challenges you think you might face, especially given the recent executive orders? So, does anyone want to share their thoughts? Patricia?
Um, One of the things that I think is important is in terms of context here is that there are states that have specific legislation that enables institutions to allow people to basically change their name to their preferred name. So that would be very important in this case. I'm blessed in a state where that is actually a thing. Um, but that's the first thing. Establishing a hopefully establishing again back to the idea of institutional culture, a place where the student is safe to be vulnerable about these things, and then advocate, right, at the level of the institution. Particularly larger institutions have a lot of um, lobbying power in with local and state governments, and that's definitely something that uh, should happen in this case.
Yeah, definitely great point. Yeah, yeah, a lot of it just depends like where you are, like what state you're in and what is like, allowed or what the legal landscape is in that place. But then also, yeah, like, the ability to kind of like lobby and see, what has been passed, what hasn't been passed, and kind of how we move forward with all of that. So awesome. And then Jonathan?
I think that I might be ignorant to locations where the law prevents you from being able to go by a different name, just because that's not what I'm used to in my state. But I think that it's a pretty common experience that cisgender people use nicknames or preferred names all the time, and that the culture allows us to refer to people by those names. And I think that trans people should be able to have that same option. So as far as like resources, I think that it sounds like this student is trying to ask permission to have their name changed somehow. But I think that if you just went directly to IT a lot of IT departments have the ability to change usernames and email addresses, or if not the email address name itself, like what name shows up on the list of that person's contact information. So you can often change those things. Um, so that's like one resource to potentially turn the student to. But the other thing is like just trying to promote a culture of respecting people's identities. This is something that I've worked on at my institution. I think having discussions about the importance of respecting people's identities and using the correct names and pronouns to refer to people, and talking about like what a dramatic impact that can have on the well-being of trans people can sometimes help to create buy-in. And then it's also important for establishing like a good learning environment. So if your school has like, say, a learning environment office, or requirements for maintaining a safe learning environment, you can help people to recognize how that contributes to the learning environment to generate more buy-in. Um, and I think just raising awareness can often help. And then also providing training opportunities, because sometimes the skill of using new pronouns is hard for some people. So making sure that people have the knowledge base that they need to be able to correctly gender someone can also help.
Yeah. Awesome. Yeah, definitely really great point. Yeah, especially, like, kind of maybe circumventing the everything kind of going to IT, but then also just, yeah, making sure everyone is kind of empowered or trained in kind of how to handle these issues. So that way, um, they're able to use the correct pronouns and kind of make sure the student feels like as, supported as they can.
Just another opportunity for collaboration here. There's the advocacy piece, which I totally agree with Jonathan, so that we're grounded in the why. This is important. Why it's not just us being, woke and all these other random terms people use, but it is imperative for learning and feeling safe. But beyond that, though, how do you do this? Familiarizing yourself with the laws of the land to know how you can support this learner, because you're the DEI officer. Them coming to you is not inappropriate, but you need to figure out and educate yourself if you don't know how best to do this. And if there are even rules in place that are annoying and clearly just not grounded in justice and equity, seeing what others outside of your institution, but near peer institutions in that state who are under the same restraints, if they've figured out some clever ways. Because a lot of this times, I feel people will reinvent the wheel. This is a theme I have. Try to figure out stuff when, as if they're the only ones who have this issue. And it may be unique. It's possible, but before you assume that, at least where I am, I know the other DEI officers at other institutions, and we collaborate all the time. Like, what have you done? How did you get around the general counsel? What recommendations did you have for changing the culture, even if we can't change the law? And then we share those best practices.
Awesome. Really great points. And then yeah, I guess, that kind of goes into what was just to wrap up because I know we're running out of time. But yeah, you're reviewing literature, seeing what the hospital and leadership policies are, seeing how you could collaborate and see what are best practices, kind of like Dr. Spencer was saying, not reinventing the wheel, but see, what have other organizations done about this, talked about this, and seeing, maybe there are resources and guidelines that they might have that are really helpful, and kind of making sure that you are, helping support the student and also preparing the student because, it might not just be their email, when they apply for things, especially when they go to ERAS and apply for residency, it's linked to your email and kind of preparing them for what might happen if the email doesn't change, and kind of how they kind of go about it, in that regard. So yeah, I know my time is up, but thank you so much for being a great, audience and listening to everything and for all your feedback. It's been a really great discussion. So thank you.